Hi, my name is Laura, and I want to talk to you today about my health condition. I was diagnosed with ovarian cancer, stage 3, in 2018. At that time, I was covered by a healthcare provider through the marketplace. Well, here's the situation, and I'm hoping that this video will reach someone that can help me with pre existing conditions for healthcare for 2019, and this is the reason why. Um, when I was diagnosed with ovarian cancer stage 3, I actually had insurance through the marketplace. Um, and prior to that diagnosis, I started to experience some health issues with my back, um, burning sensation in my stomach. Um, Stomach started getting large. I started gaining a lot of weight, and went to my primary doctor, who ordered some tests, blood and urine and whatnot. They're normal, and then she was alerted. She was actually thought I was at risk for something else. So she had requested from my insurance company an MRI, um, and numerous of times it was declined by my health insurance company. Then the pain got so severe at the end of July. This all started in May of this year. In July, it was so unbearable. I went to the ER at one of the hospitals, who gave me some relief from my stomach, um, from my stomach pain and urine pain. Um, but the insurance company declined the emergency care physician for an MRI. Okay? Well, the pain got so severe by the end of July, the last day of July, July 31st, I went back to the ER in unbearable pain. And the ER doctor said he was going to order an MRI immediately. I couldn't wait any longer for my insurance to continually decline me. To my surprise, I had a mass inside of me that was the size of a soccer ball. Well, that was on the last day of July the 31st. Um, August, I called the insurance company to let them know what the findings at the hospital, and asked them if they could refer me to a specialist. And they indicated they could not find one uh, in their network that deals with my problem, or a cancer doctor, because um, MD Anderson and a lot of the other doctors I needed to have the surgery done was not a part of their network. Well, about 7 days later, I went through their providers, their doctor providers, and found an oncologist in the Woodlands. I went to see her, and the next day I was scheduled to have surgery. Well, to my surprise again, I went to the hospital to have the surgery, and the insurance again declined the surgery. Um, so the nurse said I need to go through the ER of that hospital, that same hospital that I was going to have my surgery with, to get the surgery completed. Well, the surgery was done. I then continued to see an oncologist under their care, under the health plan that I'm currently on, and started treating um, the cancer. That's when the diagnosis came in August, that I had ovarian cancer stage 3. All right. So all was well. I kept getting letters in the mail continuously from my insurance company, health insurance company, who kept saying that the medicine that my doctor was ordering was being declined. And then, of course, I kept calling them back, and then they was approving it. It said something about the doctor's notes weren't complete, and they went ahead and approved it. But this was like continuous letter response for 15 days, to be honest with you. And 15 days of me continually working with the insurance company to get it resolved. All right? Uh, a couple of weeks ago, I received a letter in the mail from my health insurance company who indicated that they were going to do what's called a care plan for 2019. And it indicated that everything had already been approved till February of 2019 that they would approve for chemo. All right? Well, a week ago, I received a letter from the same health insurance company indicating that my premiums were going to increase, which I expected that to happen, but also that it would be the same identical plan I had before, and the cancer treatment and the drugs. They listed the drugs that have been removed from their approval were all of the cancer drugs. Like, really? So now here I am, worried about how am I going to continue to get healthy or continue my service with my oncologist if I have no resources to pay for my health care. And my health care provider is basically cutting me off because of my pre-existing condition that was determined under their care. Had they approved, now, God forbid, had they approved the MRIs when I needed it, 3 months prior to me being diagnosed with ovarian cancer, maybe the mass that the doctor found in the ER at the end of July may have not have been that size had they done the proper health care. So here's my question, and here's hopefully someone can hear me. I really need somebody to help me get my pre-existing condition approved through my current healthcare provider or a new healthcare provider that will help me get healthy. I'm surely trying. I'm doing other things to stay healthy. I'm eating healthy. I've changed my health diet, and I will have one on YouTube about my about healthy diets. That's helping me along with my chemo. But in the meantime, I'm hoping that this video will reach someone that can assist me with the current situation with the healthcare under the marketplace and my current healthcare provider. You can show your support if you like. I am on PayPal, and you can help fund me at paypal.me/L Sutton Sims. Thank you for listening, and hopefully you will reply with a response. Thank you. Bye-bye.